a quick note before we start the episode. As the COVID 19 outbreak spreads, we're increasingly finding ourselves in a very unusual public health crisis. On the Three Things podcast, we're going to attempt to cover it from as many angles as possible. But if you, our listeners, have any leads or any themes you want us to cover, do tweet to us at the rate Express Podcast or email us at podcast@indianexpress.com. Besides Three Things, we're covering other aspects of the coronavirus. So also tune in to our Express Sports podcast, our tech podcast called Our Own Devices. And on the Sandeep Roy Show, we have a coronavirus reality check with one of India's leading clinical scientists, Dr. Gagandeep Kang. Now back to the show. Hi, I'm Neha Matthews, and you're listening to Three Things, the Indian Express news show. The total number of confirmed cases in India has climbed to 151, including 14 who have recovered and 3 deaths. Maharashtra has reported the maximum number of cases, followed by Kerala, Haryana, and Uttar Pradesh. When it comes to Kerala, though, the state is leading by example in the way it's tracking and tackling the spread of coronavirus. Our Kerala correspondent Vishnu Verma joins me over call to explain why the state is now switching gears and how it's tackling the coronavirus. So, Vishnu, Kerala now had the first few cases of coronavirus which were seen in India. These were about 3 students who had traveled from Wuhan. I wanted to ask you now where things stand as of now in the state.
Well, Kerala has the second highest number of cases, active cases in the country. It has 24 active cases and 3 other positive patients who have now been discharged after they recovered from the virus infection. The pressure on the public health system in Kerala is immense, which is the major talking point, I think. As per yesterday, we have almost 18,000 people who are under home quarantine. Now, these are all people who have come from abroad, basically from countries that have been affected by the virus, including Italy, US, China, South Korea, and other countries, and the primary and the secondary contacts of them. Basically, the places that they travel to, their family, their immediate families, the people they may have accidentally met at these places. So all of these people, which are about a number around 18,000, are now in homes across all the 14 districts of the state. So that is the present situation.
18,000 people under observation sounds like a very large number. I'm assuming it's far more than any other state in India. I was wondering how, like you mentioned, this puts a lot of pressure on the public health machinery, doctors, nurses. Has Kerala changed its strategy at all over the weeks?
Yes, over the last few days now, Kerala has changed the strategy from a containment plan to a mitigation plan because it now realizes that it will not be practical to bring every patient who might have suspected coronavirus symptoms like fever or cough or breathlessness directly to the hospital and keep them in isolation there, because then that would put a lot of pressure on the public health system, and there aren't enough doctors and nurses and health professionals who would be able to tackle that number of people. So what the government is suggesting right now is people with mild symptoms should continue under home quarantine. There will be regular daily updates over the phone. There would be people from the public health system, from the primary health center, as well as the district control room, who would be calling these people under home quarantine, checking up on their status twice a day. And if these people who may have mild symptoms show severity in their symptoms, then they can be shifted to the government hospital where they can be treated in the isolation ward. But as of now, the government wants to give more priority to people who have severe symptoms. And these people are currently in isolation at the hospital itself. And also, they have segregated the contacts into 2 types of contacts, that is primary and secondary. So, primary contacts are the people who were directly in contact with the people who came from abroad. And the secondary contacts are those who were in contact with the primary contacts, people who are at less risk of contracting the infection. So, secondary contacts, none of the secondary contacts have shown any kind of symptoms. They are continuing to be under home quarantine, so the government doesn't have to worry too much about them. It's the primary contacts who are at risk of contracting the infection who continue under home quarantine, and the government is monitoring them. So that is the strategy. I think the government is trying to say that we want to release the pressure on the public health systems, we want to release the pressure on the doctors as well, and we want to put more focus on the patients who need our help the most.
I was wondering also, now there's so much talk about community transmission and the threat of community transmission in India. We know that certain places are doing random sampling. Is something similar happening in Kerala? Are we looking for people who do not have travel history perhaps getting the virus?
Yes, because there are a number of cases where people who were later tested positive for the virus traveled to a lot of places. For example, there was this family of three who had come from Italy. They had somehow got past the airport surveillance system. They did not inform the authorities that they had come from Italy. They went to a number of places, visited a lot of relatives without informing, and around 1,000 people. So the family hails from Pathanamthitta district, and there are now at least 1,000 people who are under quarantine, mainly because of the travel history of the family of three. So such incidents, the health department is worried about such incidents. We also had this recent case of a British tourist who escaped quarantine from a resort and traveled to the Kochi airport and boarded a flight, and at the last minute he was taken out of the flight and he was put under isolation. So these kind of cases have deepened fears among the health community, the health department, that there could be community transmission. A doctor that I was speaking to, he's a senior member of the public health system here. He was saying that they fear that there could be community transmission, which is why they've put so many people under home quarantine. They're strictly monitoring these people because they fear that the infection could have spread into the community. And once it spreads into the community, it would be very difficult to treat all these people.
Vishnu, I mean, Kerala is also known for a very good public health system. I was wondering if any of the officials who you talked to had anything to say about, leading by example. Should states follow Kerala's lead in any sense?
Yes, so after the three patients who had contracted the virus, after they were discharged and after they recovered fully, there have been many teams from other states, teams of health officials from states like Maharashtra, Telangana, Karnataka, who had come to Kerala. They had meetings with the health department here, and they'd taken back the health protocol that was implemented here. The health department, the public health system in Kerala is basically decentralized. It is easy to be implemented at the local level, and we have a history of very good public health professionals, community doctors and nurses who are experienced in this kind of infection, because the state has routinely battled viral infections. Like we had the Nipah virus, we had dengue, and then we had H1N1. So the state has a history of battling viral infections, and over the years, the health department protocol has been strengthened. The disease surveillance system has been strengthened. Community doctors are more involved in the whole exercise. So there's a lot to learn from the Kerala model for other states.
Could you also tell me a little bit about what, say, the community is doing? Are there any public campaigns by civic society or by politicians also from Kerala?
Yes, so the government has organized a campaign which is called Break the Chain, which is basically educating the public about ensuring social distancing, ensuring personal hygiene. So there's taps and washrooms being set up at public bus stops, railway stations, bus stands, places like that, where people who maybe they deboard the buses or trains and they directly go to the place and they wash their hands, and there are hand sanitizers and stuff like that. Also, the prisons department in Kerala is doing a very good job of manufacturing a lot of masks, the face masks, which can be used by the police officials on the streets, by doctors, by nurses. These are one-time use face masks. So that is being done very well. And also the famed Kudumbashri network of self-help women, they are very, very active in manufacturing hand sanitizers and face masks. So I think it's an all-round effort. A lot of communities are coming around to give a boost to the government campaign, and I think it is finding an effect on the ground as well.
The government has been seeking call data records of all mobile subscribers across several pockets of the country for specific days over the past few months. Does this raise questions of surveillance and privacy? Moreover, is this legal? Business Bureau head Anil Sasi joins us to explain. Anil, in February, the Cellular Operators Association of India, they had red flagged requests by the government. Could you tell our listeners what these requests were?
So essentially, local circle units of the Department of Telecommunications, they'd been asking for call data records on a bulk basis across specific pockets of the country. Some specific states, this was happening on a monthly rotational basis on specific dates for certain states, and also on an ad hoc basis across specified dates. again for certain areas. So that had been happening for the last couple of months, maybe a little more, but the periodicity with which these requests were coming in, it seems the operators decided to raise the red flag. So they shot off a letter to the DOT secretary saying that this is a trend, and they cited various reasons why this could be probably in violation of the laid down norms.
I'll ask you about the norms a little later. Could you first explain these call data records? What sort of information would they give?
So they, the CDRs for a subscriber would have a string of information about the particular mobile number for a certain period of time. This information includes details like the subscriber's name, the calls made by the subscriber during this given period of time, which could be like 12 months or 13 months, the duration of the call, whether the call was terminated normally or abnormally, the location of the caller, the location of the recipient, the call recipient, and several other such details which are prone to sort of misuse.
And now obtaining these call records itself, I don't think is illegal, right? But were these requests unusual in any way, or did they not adhere to guidelines?
Well, there are two sets of requests that come in. One is law enforcement, for which there are a clear set of laid down procedures and rules. This is different. This is by virtue of a clause that is there in the licensing agreement that the DOT has with the cellular operators, under which the operator is obliged to retain CDR data sets for a certain period of time and also share it with the licensor, in this case, the DOT, as and when sought on security grounds. Now, this one is by virtue of this clause in the licensing agreement. And it is not very, very clear as to whether the protocols that you have in place for this are as strong as they are for law enforcement.
And I think you were looking through these as well. Is that I think you mentioned in your piece that there needs to be probable cause, right? Also to ask for the data of people, call data records. Were any reasons provided?
No. So one of the issues that some of the people that we spoke to, including those who've been with the telecom regulator, what they said was that in all of these cases where details are requisitioned for numbers or a set of numbers, they have to necessarily give a reason. In this case, according to the operators, at least the letter that they said that they were not given any reasons, and these were details that were sought in bulk on certain days of a month, but across the board on a mass basis. And clearly, when you seek data on a scale like this, you can't exactly provide details because that's generally done for specific numbers or specific cases. So in this case, the operators alleged that there were no reasons given.
You were also investigating this. Did you see any pattern as to, what particular dates the call data records were sought?
No, for the states, the dates are random. The 18th of every month for Delhi, for instance, the 15th, of the month for some states, the first and the last day of the month for some states. So, there's no, very concrete pattern to it. But yes, in some instances, like in Delhi, details were sought for the 2nd, 3rd, and 4th of February. Now, the operators seem to suggest that, look, this was at the time that the whole CAA protests had sort of intensified in the capital. And also, we were just a few days away from the close of campaigning for the Delhi elections. And I think 4 days before the polling was to be held. So, there's no clear denotation of the link really, but people are sort of looking at the dates and, pointing to possibilities of there being probably a cause that could be linked to these sort of dates that were to follow.
Yeah. And Anil, I think you mentioned in your piece as well how these requests kind of bring up questions of surveillance, of privacy of the consumers. Has the COAI, they filed a complaint to the Secretary of the Department of Telecommunications, but what action can be taken right now on these requests? Can anything be done?
No, the COI has sort of alluded to this. And in fact, they've said that some corridors are fairly sensitive. Delhi, for instance, where you have a number of high-profile VIPs in, for instance, the Lutyens area, judges, ministers, opposition leaders. But there is no direct link, really, and it is difficult to establish if the patterns that emerge in terms of how the data was being requisitioned can be directly linked to specific numbers or specific personalities. But that sort of information is not there. It's just guesswork, and I think that's what the telecom operators have sort of hinted at. So, in terms of the legality of it, the fact that there is a clause in the licensing agreement and that this is being done in line with what the clause provides, there's no legal basis really for the operators sort of challenging. In fact, one of the operators that we spoke to said that they had no choice in the matter. but to comply with it. But a senior officer that we've spoken to who was in the TRAI, the Telecom Regulatory Authority, well, he had said that this is unprecedented and that there is no way that you can randomly seek data across circles on a rotational basis, on a continuous basis, because that amounts to sort of misusing the provision in the licensing agreement, and that too without specifying a reason. But that really is what sort of raises the red flag.
Okay, and I'm sorry, just to end as well, I want to ask you, have concerns like this ever been flagged before?
Well, in 2013, there was this minor controversy involving allegations of CDRs of opposition leaders being sought by the then UPA government. There was a discussion that happened in Parliament, and former Finance Minister Arun Jaitley was one of those who spoke on behalf of the opposition. And since then, there was some tightening of the rules. But look, these were largely pertaining to law enforcement and requisitioning of data by agencies. It's a different sort of a thing from what we are talking about now. And there was some tightening of the rules done, in terms of these approvals needing the concurrence of the Union Home Minister or the Principal Secretary of Home in States, and then an SP level officer needing to make a mandatory disclosure before the DMs on the end of every month on the numbers on the CDR sought. But again, these are purely for law enforcement action and not the kind of requisitioning that we're seeing in this case.
With travel advisories coming into effect, increasing numbers of Indian students are finding themselves stranded, unable to return home. Ritika Chopra, who covers education for the Indian Express, joins me to explain what procedures have been put in place by the government and what Indian students abroad need to know. Ritika, there's been a lot of confusion, especially for students who are abroad coming and want to come back to India during this outbreak. One of the things they wanted to know, I think a lot of people have been asking, is with the travel advisories in effect, are there any students who will not be allowed back to India from certain countries?
So, as announced by the government on the 16th evening, no passengers from the European Union, UK, and Turkey are allowed into the country till the 31st of March. So, obviously, people, irrespective of your nationality, even if you're an Indian and you're living in the UK, European Union, or Turkey, you would not be allowed back into the country till the 31st of March. One doesn't know what's going to happen after 31st. Some people are expecting the government to extend the ban. We're not really sure if they're going to lift the ban after the 31st.
So there's also talk about students being sent for forced quarantine when they return from certain countries. And could you tell us what countries those would be?
So there is a list of countries for which there is compulsory quarantine for 14 days. My understanding is that by compulsory quarantine, irrespective of whether you show symptoms or not, you will be quarantined for 2 weeks. This, of course, includes affected countries like Korea, Italy, there's Qatar, if I'm not wrong, there's also Dubai on that list. This is a list of countries which was put out by the government a few days ago. But based on our interaction with students who managed to come back to India within that 48-hour window after the ban was announced, it seems like even if you're not on that list of countries, basically passengers from where would be compulsory quarantine, you will be quarantined if you show symptoms. So for instance, a couple of hours back, I spoke to a student who's come back from the UK and she's in Kolkata right now, and she couldn't find a direct flight back from Gatwick to Kolkata. So she had to fly via Dubai. And because she came via Dubai, it was a layover. She was screened at the Kolkata airport. She didn't have any symptoms, so she was allowed to go back home, but asked to self-isolate for 2 weeks. But some of her passengers, some of them who flew with her from Gatwick to Dubai to Kolkata, and some of them who probably boarded the flight at the Dubai airport, she's not really sure whether they had symptoms, but clearly they didn't sort of, clear the screening test. And they were asked to stay back. And there seems to have been some fight between those students and the authorities at the airport, because students claim that, look, we are from UK and we're not on that list of countries from where people have to be compulsory quarantined. The logic given to them was that they had certain symptoms and they had to. So the understanding is that even if you're not on that list, if you have symptoms, you will be sent into compulsory quarantine.
And do any of these students, anybody who's now planning to come back from any country, do they have to make sure they're already tested for coronavirus before they come?
So students from Italy and Korea, that's my understanding, they would have to get this corona negative certificate before they fly out from those countries. which means that they cannot come back to India unless they have that certificate.
So, Ritika, the thing is now this 2-day window is over, and we have a lot of students who are stranded in countries abroad. Some of them may not have places to stay, etc. Could you tell us what sort of problems they are facing if you talk to any of them?
Obviously, people who have managed to come back to India in the last 48 hours are people who have had, many of whom have had to pay through the nose to buy these last minute tickets. Some of the students that I spoke to yesterday, of course, they were lucky to have found a ticket for about 40,000, a one-way ticket for 40,000. But they said that, in a couple of hours, the same flight tickets were available as much as 1 lakh rupees. So obviously people who can afford to travel back have done that. What we need to remember is that, this ban, what happened with the ban was a lot of students anyway had plans of coming back to India. This is because universities in the UK are shutting down. They are moving their classes online. And people in the UK, as of now, they are being advised to self-isolate even if they have symptoms. So that has led to a bit of a panic among the student community, in the public, at large, and also specifically among the community of Indian students, which is why they felt that it was better for them to be back home. Because if classes are going to be online anyway, they'd be able to attend those classes online.
You were listening to 3 Things by the Indian Express. Today's show, as always, was edited and mixed by our producer, Joshua Thomas. If you like the show, then do subscribe to us wherever you get your podcasts. You can also recommend the show to someone you think will like it. Share with a friend or someone in your family. It's the best way for people to get to know about us. You can also tweet us at Express Audio and write to us at podcasts@indianexpress.com.